Hi, everyone. My name is Jamie Smith, and I am your host on today's Nurse Deck podcast. We are interviewing Marijana today. Hi there.
Hello. How are
Hi.
you doing?
Doing great. Tell us a little bit about yourself.
So about myself, I have been a registered nurse for going on 24 years. Most of it has been acute care, critical care, ER, of educator, ACLs, pails, flight nursing, some administrative roles, and most recently, I graduated with my doctorate degree from
Great for
Columbia
you.
University. So I'm looking for the perfect fit Peds NP job is where I'm at these days, while still working in the ED.
Good for you. Congratulations on
Thank
getting your
you.
doctorate at Columbia. That's awesome.
Thank you.
So tell us, what drew you to the nursing profession and specifically to pediatric nursing?
So pediatric kind of came down with years of experience. My first goal, honestly, as a very young adult, I was a single mom. I ran away from home, dropped out of high school, did all that. And, having the motherhood role assigned to me is like, oh my gosh, I need to do something that will benefit the world as well as support me and my son at the time. And I was like, you know what? I did this whole natural pregnancy. I did this whole natural childbirth. I am going to become a nurse midwife. That's what I'm going to do. So that was my goal for, taking high school chemistry, acing that, and rolling into a diploma program because where I lived in Erie, Pennsylvania, St. Vincent's Health Center was a diploma program where most of the nurses, as soon as they finished school, were ready to roll and take care of patients because it was more hands-on based. So that's really what I wanted to do. I was, receiving assistance from the Commonwealth of Pennsylvania that I was ashamed that I was getting. So I really wanted to just do my part, contribute, and also raise my child. So my first job was post-op cardiothoracics, where I learned a lot, patient management. I was like, this is really cool. When I had interviewed for my first job, which was at a competing hospital that I went to school. I went to school at St. Vincent's Health Center, which no longer exists. So there are two big trauma hospitals, Hammett Medical Center, which is now UPMC, and then St. Vincent. So I went to a competing hospital. They're like, oh, you could be, an ICU nurse and an ER nurse. And I was like, whoa, pump the brakes a little bit. I need some experience. And for the step down unit, there's really a lot of responsibilities. My patients still had pacer wires coming out of their chest. They had vasoactive drips, carotid endarterectomies. There's like just a lot for me to digest and get hands-on experience with. And then I'd relocated to Western New York, where I spent most of my nursing career and really developed a love for nursing and taking care of patients and just learning about myself and the human spirit is really where I learned where I was pretty much so raised as a nurse would be Western New York. So I started on their med surg unit, and that was also pediatrics. So that was kind of my real first introduction to peds. And I was like, wow, there's, a lot going on here. And then the ER drew me because I like the autonomy. I like the excitement of not knowing what type of patient's going to come in. And that was a small community ER with one attending. On night shift, I think we had 3 registered nurses, 29 hospital beds, which a lot can happen. I love having a big education facility to be a part of, but really being in a small community hospital is where you really grow with your clinical skills and development. So that's where I became a nurse in the ER, climbed to the clinical ladder, got my CEN, did all that, wanted to be really hands-on, mixing our drips, resuscitating patients, et cetera. So we also had a flight program, which was Starflight Corporation, had been developed by a former nurse that I'd worked with. He was a former vet. 1984 was when Starflight was born. And just seeing the nurses that worked in the ER were the flight nurses for the team, and just seeing how strong they were and their knowledge base, it had really inspired me to kind of pursue that. So I had twins at the time, and my mom was like, what do you want to fly for? She goes, you have children, you can't be up in the air with the birds, etc. And I was like, I really want to do this. And it wasn't really until most recently that I was thinking about it. Before I ever even contemplated being a nurse, when I was living in Erie, Pennsylvania as a young adult, adolescent, young adult. I was there 17, 18. And the helicopter, you could hear the helicopter. And at the time, Starflight flew a Huey, an old medical helicopter. So you could hear that from like 5 miles away. So I'm taking my dog for a walk, going down to the Erie Pier, and I hear the heli, and I'd be like this, hi, hi, just like waving. So I had that sense of joy in me for the helicopter, not even contemplating a career as a nurse yet, much less a flight nurse. And I finally said, you know what, this is in my heart. I want to do this. So I applied, I received the position, had never been in a helicopter before. So I'm strapped in my first flight rotation. And I'm like, oh my God, you've never been in a helicopter. What if you hate this? And the helicopter cranked and my little heart went do, 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 just like the helicopter. And like, that was it. I was in love. So that was one of the jobs that I could fly nonstop. I would fly if they didn't pay me. I was very passionate about that. And I think that's super important with nursing in general. And I think that's why I have survived at the bedside for so long, is because I do care. I am passionate about, delivering the best care possible and advancing my knowledge, and also teaching, because we have a whole new generation of nurses. And now I'm like the senior nurse. I'm like, what happened? I used to be the baby nurse that everybody kind of took under the wing and taught. But with flight, I would take 3 12-hour shifts call from the ED. So I'd have my flight pager on, and wow, I was like super excited. It was like a party, for me to get in there and see where I was going, what was happening. And the flight call pager, if my relief was sometimes at the helipad at 18:57, I'd be like, it's still my time, I'm going. So probably not the polite thing to do, because my relief was there, but it was just, I love that job so much, because you didn't know what exactly you were going to be called to act on. You could have a scene call where there's a mass casualty on the expressway. You could end up in someone's backyard, a ski resort, interfacility hospital transfers. And even if you think something's going to be a benign call, it ends up being a total disaster that you kind of dissect and go, wow, we did really good with what we had to work with. And that was a paramedic and myself and 2 pilots. It was a very special program. That program no longer exists. It's been initiated by somebody else, or someone else took over on it. But that really was the highlight, one of the highlights of my nursing career. And then I had wanted to relocate from where I was living, Chautauqua County. I'd been there for 15 years, and I just wanted to change. So it was between Tampa and New York City. And at the time, my daughter was 13. I was like, what do you think, New York or Tampa? And my heart was kind of leaning towards Tampa, because on the days off, I could go swimming, scuba diving. They had a beautiful, Tampa General had a beautiful helicopter. I'd already scoped all this stuff out. She goes, no, New York. I was like, okay, so New York it is. So I had resigned from the ER because there's a lot of transitions, and I had been there 15 years. I stayed on flight until mid-December before I relocated to New York. And then I was in the ICU at Olean General, which was great. It's a great place to learn your drips. Bad things happen in the ICU, but it's a controlled environment, whereas the ED, it's chaos, and you just got to make it work. Like, we want to control the environment and do the best that we can, but the excitement of the ED is the unexpected and, thinking on your feet. Same thing with the ICU. It's just a little bit more controlled. So I had that, and I was like, if I'm going to relocate, let's just try travel nursing until I find the spot that I'm going to go to next. So I did travel nursing, and I ended up at Children's Hospital. And I felt that I always had a pretty good grasp on my pediatric patient care, just because the ER was for all patients. So we had deliveries in the ED, newborns, and then stabilize and transfer them out to specialty resource center. So I was like, I could do peds. I got this. And I did have it. It was as a traveler, that was my first traveling experience. So you kind of have to earn the respect and the trust of the staff that are there. Travel nursing it's a great opportunity for a lot of individuals who, I would say, have experience. I wouldn't say go into travel nursing without
Right.
experience, because that's just not safe for anyone. But that's where I really learned that intricacies of pediatric care because it was a specialty hospital that just cared for peds. And I was like, I could really do this. I really like this population. Um, with adults, right now I'm in the emergency department in New York City. I think, had I started my nursing career when I first moved here, I probably would have hated it. Because I came on to patients, it was one nurse to 15, one to 22. There was no assignment of acuity. It was just, I was like, wow, how do people stay in nursing with this? But I knew from my previous experience that I love nursing. I love being able to provide quality care, but that's just insane. And there isn't a cap in New York for nurse to patient ratio.
Um,
There's no cap. So it's dangerous. So sometimes, ER nurses, we get a little, upset when somebody says, "Oh, you don't have critical care." Well, I'm sorry, but we've had this ICU patient now for 36 hours. I mean, that's kind of unheard of, but at least 24 hours, that's still, critical care and being able to initiate care and stabilize a patient and then maintain them until transfer. So the ER really has become a mini ICU. And then in the height of COVID, that was just, having 6 intubated patients and just constantly monitoring drips and maintaining them. It was really a chore that I still kind of look back and I go, what happened? So yeah.
wow. I want to put all this together, everything that you said, because it's a lot, and I want to
Yeah.
let our viewers know, kind of put it together. So, correct me if I'm wrong. So, you've been a nurse for 24 years,
Mhm.
educator. You've been ER nurse,
Mhm.
clinical matter. You said flight
Mhm.
nurse,
Right.
administration, and you just got your DNP with Columbia
Right.
University. What I found really, and it captured me. You said you were a single mom and you ran away from home.
Oh, that was a really long time ago. So I was 16. I had kind of so my capstone for my DNP, and I think the reason why it took me so long is because I chose a situation and a patient that was kind of close to my heart. So I wanted to research adverse childhood experiences and kind of piece that in with the patient that I was working with, plus with the medical conditions that I was writing about. So I think that's why it took me a little bit longer than some of my classmates. Had I just done something that was clinical, boom, 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 I probably would have been done, last spring or last December. But as a youth, I struggled a lot. There was, divorced parents, foster care, being bounced around from one relative to another. So, it was a challenging childhood. I grew up in the former Yugoslavia with my grandparents. They rescued me. They were my angels and took me back with them and kind of let me I went from a very restricted, abusive environment to, okay, you are the princess, the firstborn, have whatever you want, which is not necessarily a good thing for a kid. But that was the experience that I had. And I'm very grateful for the love and the time that they gave me. But then when I came back to the US, it was my first time living with my mother. And it was very challenging. I went from a former communist country where I was, the most popular kid. I was the Americanka, my grandpa drove a Volvo versus, so there was a lot of, I went from a huge cultural transition to living with my mom for the first time. And then I kind of lived in a very affluent area, so it was an adjustment and then the little cliques. And I felt that I did really good freshman year, sophomore year acclimating. And then it was just too much. And as an adolescent with all the best resources, parents together working, et cetera, it's still challenging trying to navigate those hormones and transitioning. So that I have like a, a real soft spot and understanding for that population because oh, they're wild, and I'm like, yeah, but there's reason they are. So then I was like, things aren't really nice here. I think I'm just gonna take a little spiritual vacation. And I kind of became a groupie, if you would say. The Grateful Dead was in town. So I was like, oh, they like music and peace and love. I was like, I think I'm gonna try this for a little while. So I did, and I was like, okay, this is only a phase. I need to figure out what I'm gonna do when I grow up. So when I turned 18, that was kind of like a little marker for me. I was like, okay, it's time to be grown up now. And then I had my son at 20, and then I really decided that it was time to grow up. So yeah, and I think, you know, a lot of people, I have some people go, oh, Columbia, this and that. And I'm like, but you don't understand, coming from struggling in school throughout all of my early education. And then, when it came time, I devoted myself. Yeah, it was a diploma program for my first nursing experience. Those were all straight A's. Like, I applied myself because I had a mission, I had a drive to accomplish something. And then for Columbia, like, I really honestly didn't think that I would get in. I was like, they probably want a great, perfect history. And I think it's just kind of what your mission is and what your goal is, and having a passion about something. So for me, um, it's been challenging trying to find the proper Peds NP role that I will be excited to roll out of bed for every day, whether they pay me or not. And I think the pandemic kind of impacted that a little bit. And I perhaps would have been, I know I would have been working right after passing my boards with an FNP, but I chose Peds because it is really, to me, it's the most rewarding. So my life has just kind of been about what's going to bring me the greatest joy. What am I passionate about? Because it really is, sure, at the end of the day, I think most healthcare providers know how things can just, on a flip of a switch, change. Um, so peds, I really, even if it's a minor earache or something like that, it's just, it's a joy taking care of them. And, people say, oh, the parents. I'm like, I'm a parent. I've been there. I know what that's like. I know the anxiety of when your kid is not acting like they should be. So, yeah, I had no regrets choosing peds. I wish I'd probably, added an FMP into it, but peds is really what I'm most passionate about.
Well, I must say, thank you so much for sharing your story. It takes courage to share your stories. It's personal. You
Right.
said you ran away. You said it's 16 and you
Mhm.
went through foster care and
I was in foster care as a child, a young child, um,
yeah,
second grade, third grade. Yeah.
yeah, and you had a baby at 20 years old and
Right.
you were driven. You said you knew you had to grow up
Right.
and you wanted to do something and
Right.
look at you, your drive and your passion and Columbia and you finished your doctorate. So thank you for sharing your story.
Thank you. I hope it like just inspires someone, like, if they're feeling, I can't do this, I can't do that. There's a lot of challenges, but it's just preservation and just having the belief in yourself and a mission and a drive to complete what you're going after.
That's a powerful statement. That's very true. Tell us how does pediatric nursing, how does that differ from adult nursing?
You just kind of have to kind of woo them. You have to be honest, but the approach is totally different with peds. For me personally, I find that I like the provider that I am when I'm dealing with pediatrics. Um, I think each nurse is different. We have, not to stereotype, but we do have differences. Some people are much better at, palliative care, hospice care, geriatrics. I'm compassionate. I can do those roles, but is that my passion? No. My passion is trauma care. I love trauma, taking care of patients with heart attacks, strokes, the critical care drips. Are we intubating? Are we sedating? What are we doing? I need that. I'm that type of nurse when it comes to the adult population. But with peds, it doesn't matter if they're there just for a well check, if it's a traumatic injury. There are sad cases in pediatrics all around the world, depending on what the zip code is or geography. Some populations have more trauma than others. Not to name any boroughs in New York City, but there are certain institutions where you see a higher level of children being maltreated and having injuries. So just being able to switch the hat and take care of them. And then our complex kid population, because of the advances of healthcare, our kids with complex needs have special care and special assessments that need to be taken in account for. So peds is a lot. And even though I've just completed the program and I've had hands-on, nursing experience with pediatrics most of my career, it's always a learning experience. There's always something to learn and go, well, wow, I didn't know that, or, this is interesting. And then the genetic conditions, it's just, to me, it's like there's a never ending source of education.
So to our viewers, our listeners, how would you guide them as far as if they're interested in becoming a travel nurse, what would you want to tell them and what skills does a travel nurse need?
Adaptability. adaptability and being able to be flexible and a people person. I've found that, right now, most of our staff has gone to travel. So they've been replaced with travelers. So we are kind of outnumbered by travel nurses right now. But my tip would be rather than just wait and get 1 year of nursing experience, dedicate your time to learning your craft and being proficient without having to ask for, resources, et cetera. I mean, basic resources that you should know if you've been in your role for a couple years. So I have seen a couple nurses go out and do travel after only being a nurse for a year, and I just don't
Yeah.
think it's a wise decision. But for nurses who are experienced, by all means, go for it because it's exciting. You're getting acclimated um, to new patient populations, how facilities work, and honestly, if it's not going well, it's a 13-week assignment, 8 to 13 weeks. For me, it doesn't work. As free spirited as I am, I kind of enjoy having stability and a routine, and being a mom too kind of probably affects that. And living out of a suitcase really isn't. I've been there, done that. It's not for me.
So, can you tell us more about any impact or changes that the pandemic, COVID-19, has brought into travel nursing?
So I think travel nurses are really doing well financially right now. I think they're really benefiting from the situation when it comes to crisis pay, because a lot of full-time nurses are leaving. And I know I can speculate a lot of the reasons. I know a lot of the reasons why they're leaving is retention. And this is, when I did my bachelor's, this was my project was staff satisfaction. If you don't have satisfied or happy staff, you're going to have a really hard time having happy patients. It's just kind of like a chain reaction. It's a common sense thing. If I'm in a good mood and I want to be here, I'm going to go above and beyond to take care of
Right.
somebody else because guess what? I'm happy here. So I just think that that's kind of at a loss on a lot of organizations is, if your staff is not happy, they'll go someplace else because there's someone else who's going to offer them what they're looking for. So even if they're not getting that sense of, home and family at the wherever they're traveling at, they're getting other benefits, like traveling and exploring the world or exploring the state of, the location where they're at. So it's kind of a payoff. And, I support my colleagues who are doing it. It's not for me at this time because I have different goals and aspirations. But I'm like, oh, that's a really great way to pay off an education. That's a great way to put a down payment on a home. It's so but also I feel like a lot of our nurses who were close to retirement. This is my first time being really at a union hospital. My first 15 years were at a non-union hospital. So unions are a whole different topic, but they were close to retirement and many of them opted out to take an early retirement working just a few months in the pandemic because it really was. I'm not going to talk about the negatives of it, but it was really demoralizing seeing deceased bodies being carried out to
Sure.
so that definitely impacts where, you've got your 6 vented patients and you just, see, it really does scar you a little bit where you're going, wow, that's just insane.
I'm sure. Like, I don't even know what to say to that. Just,
No, there's nothing to say. It was just like,
yeah.
yeah. So,
Yeah.
but
Well,
yeah, I feel like the pandemic has helped out travel nursing a lot, just for the crisis pay. I think every institution is different, but I would feel so much better about the whole process if organizations worked on staff retention. And I think when people feel like they're valued and respected and appreciated, and they get to use their holidays that they earned and they get to use their vacation that they earned, that they'll be like, you know what? My employer looked out for me. I think I'm going to stay here.
right.
There's a lot of nurses that just recently left that I think if they were offered some sort of differential, a couple extra $100 an hour, that they would have been like, I think I'm going to stay because most people like to feel like they're a part of something. as
I
long
want
as
to,
it's not toxic. If it's toxic, please leave,
right.
run. But, most people like to feel like they're part of something. And I know it wasn't an easy decision for some of the nurses who left.
I like your comment about feeling appreciated, getting paid what you're worth, because that can impact positivity, your
Mhm.
attitude, the morale of everyone, which can,
Productivity.
yes, for sure, and it impacts
Mhm.
your patient outcomes.
Right. It does.
Yeah. So you were also part of the critical care transport for quite some time. How is it to be a flight nurse?
So that's part of the flight nursing team. So our program, if it was red for weather, we responded by ambulance. So, it'd be a little bit longer time with the patient. We actually flew to a couple different states. We were based in Western New York. Most of our flights were to Buffalo area hospitals, depending on what the resource required was for the patient, or Erie, Pennsylvania. We had flown to Pittsburgh quite a few times, and Cleveland Clinic, and Rochester, again, depending on the patient's resource need. But that's amazing. It's the highlight of my life, really, honestly. And
That's
then managing the drips, and then there was always a medical control doc that I could be like, hey, doc, this is what I have, and how can you guide me? What can we do? Because not to divulge information, but there were quite a few scary moments, en route to a receiving center where the patient codes. I've got to max out on vasopressors, and I have med control going double it up. I was like, okay, I know it's not. I know it's not part of the recommendation, but if this is
I
what
do what you got to
keep
do.
our patient alive, this is what we're doing.
Right.
So, yeah, really the highlight. I mean, it challenges you to be hands-on, and I think that's why I was confident in myself in becoming an advanced practice nurse. And I have
Good
a
for
comment
you.
about that. For NPs, I feel that nurses should at least have at least 5 years of nursing experience before they venture into advanced practice, because every program is different. And I would like to see kind of like a uniformity across the nation for advanced practice degrees. Most physician assistant schools have a standard approach. Med school has a standard approach.
I see what you're
Um,
saying.
I feel like, yeah, okay, we can get our NP and go out and practice, but where is your, previous bedside nursing experience? Could be lacking. So
Right.
I do feel a certain way about that.
I do too. So I
Good,
appreciate
I'm
that.
glad, because
Yeah, I do too.
how are you going to know that, what needs to be done if you don't have at least those years of experience to be.
Exactly.
And I honestly feel like, yeah, you could, in 2 years, you're confident, you're feeling good, but you're learning. And I'm still learning a lot. But I think in 5 years, you have a pretty good head on your shoulders where you can make a decision and be confident in that decision in a life or death circumstance. I don't think that comes really before 5 years unless you
I
have.
couldn't agree with you more. And I'm very passionate about the standard approach idea. So I
Right.
feel you on that.
Thank you. Thank you. And then I have a huge love for pre-hospital care, just because, I enjoyed when our program was going through a transition stage. We were taking flight with the paramedics. So how it used to be set up, I would be a flight nurse in the ER. I'd have my pager. So if it was from the ED and I actually had that patient, talk about continuity of care. I'm like, he was on the lawnmower mowing, came in, crushing chest pain pail, diaphoretic. We tubed them. These are the drugs that we gave. And now I'm taking them to the cath lab. Like one time I
Right.
was still in my little white nursing uniform, and the cath lab team, because we went there so often, they're like, where's your flight suit? I'm like, there was no time to change because he was critical. We just had to load
Yeah.
and go. This is what
Gotta do
we're
it.
doing.
Yeah.
Nursing clogs and everything. So now, you know, I did what we had to do. But EMS, I feel like, holds a special place in my heart, just having seen the type of work that they do and the lack of appreciation that many of them get. So I feel like it'd be really cool if, an ICU nurse came down to the ER for, a couple weeks. I think it'd be really cool if an ER nurse went to the ICU for a couple
Different
weeks, just so
perspectives.
you could see what the process is.
Right.
A floor nurse to come down to PDD so you could see what we're doing. A nursing to go out in the field and go, oh, this is a lot of work for what these people are getting paid. They're not compensated to the type of work that they do. I think they
I
can.
agree with getting the perspectives from different
Right.
areas, like ER, ICU, and so forth.
Right.
I did MS too, so I feel
Oh,
you on
cool.
that.
All right. Yeah.
Yeah.
Cool.
So
I mean, it's a very exciting role, not knowing what you're going to. Some of the homes are, so I would run calls with my flight medic when I was in the station, the helipad station, waiting for flight calls. So I was like, wow, this is really cool. Can we go lights and sirens? No.
So tell us, Mariana, do you think that a high level of burnout in nurses is more likely to be experienced in critical units and emergency
Absolutely.
departments? I think it is, but what do you
Absolutely.
think?
No, 1,000%. And just my perspective, being that I, work in a New York City ER, our psychiatric hold patients, they had closed our psychiatric unit during the height of the pandemic to make ICU beds, extra ICU beds. So that patient population doesn't really have a resource. We can see them, we hold them in the ED, and being a regular patient with medical conditions, being stuck in the ED for 36 hours, and now you have patients requiring mental health needs, it's not conducive to them. So I understand that we're reopening up again, but even with us reopening, I feel that the pandemic had made things so much worse for patients with mental health needs. And then the underserved population, the homeless population in New York City is just astounding to
I
me.
didn't know that.
Oh,
It's
it's really bad. It's really bad. And just I understand, a shelter is supposed to shelter you and protect you, but I always question, if that's the case, then why are some individuals choosing to sleep outside, or choosing to be on the train, or choosing to come to the ED? So for me, that's heart wrenching. And it crosses my mind very frequently, as to, what's the fix? And I know greater minds than mine have already tried to figure it out. And I don't think anybody really knows. Like, I just wish there was more that could be done for that population.
yeah,
It's a
yeah, for sure.
complex situation, but that inundates the ED with patients who have medical concerns, and now you're being tasked to switch between a mental health nurse, social work needs, and your patients who require medical attention. And it's not just, oh, chest pain or a GI bleed, it's the whole person. So, it's easy to get focused in on that one aspect. And then I think for the critical care, I just think it's the high volume. And then if your patients aren't doing well and you're putting forth all this effort to maintain, life, and then at the end of the day, it just doesn't work out. I
Right.
think that's,
So Mariana, how do you go about identifying your own burnout and how do you prevent and handle it?
um, well, I can pick up when I'm kind of in a cantankerous mood that I'm burning out for the day. I've contemplated, like, throughout the nursing career, I'm like, oh, do I want to be a police officer? I tried switching drastic roles, and I was like, no. I mean, at the end of the day, I love being a nurse. Having been on the planet for as long as I have, and that with my nursing experience, I think I'm more in tune to recognize this is just burnout. So take time to focus on me, and do things that bring me joy. So spending time with my child brings me joy. Going to Disney brings me joy. I booked, it was a last minute trip and a last minute decision, but I was like, I think we need Disney in our life. And that's what I went and did, and it really did not matter what else was going on. Taking the time to take time to do yoga. I find that I don't do it often enough, but once I do it, I feel very zen and very at peace, and my approach is different. And my response to life is different. So understanding that I am kind of, I'm a great ER nurse. I've done it for so long. I, enjoy working with my attendings on the adult side, but my heart is with peds. So I recognize that once, we get a little bit more stabilized with, the pandemic and our volumes, it's nationwide. I communicate with my friends in Western New York, and, they're seeing patients in the hallway and in the stairwell. That's a problem. So I think the volume is nationwide problem. But once that kind of gets settled down, my focus is going to be solely peds, just because that's where my heart is happy. That's where I shine. That's where I really take the time to make sure that my patients and their families know what's going on. So that's just what I'm passionate about.
Marijana, what are your thoughts on the community, and how do you think nurses can benefit from the Nurse Dex community for nurses?
So I just signed up for Nurse Deck. I've not really been on that platform so much, but I feel it's super important with just the ever-changing arena of healthcare to have people that you can relate to. And as nurses, I feel that we relate to one another very easily, but it's nice to just have that, moment of validation, because we all go through some struggles. Some days are really significant compared to others. And I just think it's a great opportunity to network and just kind of see what's out there. I do belong to several organizations. Whether I'm active or not is an entirely different story, but it's just nice to have kind of little snippets, because we are in a world of information and there's so much information that it's just nice to kind of have a community of nurses that we're just nurses, and this is what we're dealing with in a certain area. And, sometimes we can give positive feedback or encouragement or get it ourselves, because if it's a bad day and you just need to kind of go, this is what happened, without really revealing any HIPAA stuff, it's nice to be validated and go, yeah, that was a crazy day. Or, it's nice to have that. It's kind of like a debriefing, but not an official debriefing, so to speak.
Do you want to mention any groups or organizations that you are a part of?
So I'm part of the ENA. I think I will forever be part of the ENA just because that is my heart. I feel that the Emergency Nurses Association provides great resources for nurses and the changing climate and what it costs to train a brand new ER nurse. A couple years ago, I was listening to it in between doing my research for school, and that was a couple years ago, and it was about $88,000 to train. Yeah, that's it was in the 80,000s to train a brand new nurse to the ED. So I'm like, this should behoove administration that, if you're spending this much money to train a brand new nurse to the ED or to critical care or wherever you want to train them, you should probably work on retaining them. I'm not necessarily sure where the funding's coming to compensate multiple travel nurses, but it's got to be more affordable to retain nurses. I just don't know what our fix is in the long term, but there's, the system is broken and a lot of my colleagues are worn out. And I just, travel nursing may be a nice fix in the interim, but I think long term there's, something. I don't even know what the fix is. I don't know what the recommendation is for that. So the ENA, I belong to the National Association of Pediatric Nurse Practitioners. I feel that that kind of keeps me in the loop and abreast of, information that I need to know, especially when I start practicing. Hopefully I find the proper job that I'm going to be so excited to go to. And then American Association of Advanced Nurse Practitioners. So those are the three big ones.
So you said the ENA, Emergency Nurses Association, and the AANP. Is that right?
American Association of Nurse Practitioners, and then NAP, it's so Peds appropriate, National Association of Pediatric Nurse Practitioners. So I just, yeah.
So is there a topic that you would like to discuss or address that we haven't already?
No, I think we've covered a lot. There's many things that I'm passionate about, preventing ACEs, adverse childhood experiences. There's research on research approved, tool for assessing for them and having, primary care offices use them. Just another assessment tool for primary care to do. It's just primary care has so many responsibilities that I didn't really know until I got into school. And then I just think nursing ownership of our profession and leadership, it should be nursing run. And then with the NP education, I just feel like standardizing that across the nation is super important just for the delivery of care for the patient.
I agree, 110%.
And then just, something for our pre-hospital, employees that work really, really hard in the streets, and depending on what their geographical area is, they have, their life is more at risk than, someplace else. So there's a lot of risks, and I just hope we could all pull through this.
Oh, yeah.
Not been untouched, untouched. It's, we're touched, but it'd be nice if we could just kind of build on the resilience of resources that we have.
I feel you on that. I would love to continue the conversation on our Nurse Deck Social. Have you heard of that?
I think I have. I haven't really explored the site. I think I just signed up for it, but I've not really explored the site.
Well, join us. It's like a little Facebook.
Okay, cool. I will. Definitely will.
So, Marijana, thank you so much for your time today here on Nurse Deck and joining us on this podcast. You've had 24 years of experience. You've done a little bit of everything. You know your heart's in pediatrics. And so thank you so much for your time today and sharing your story.
Thank you. I appreciate your time and thank you for listening. I hope it helps someone.
It definitely will. Thank you.
Thank you.